about the like monitoring and evaluation and the data and the challenges you have with the data and the platforms that you use. Can you give us a little bit more context on the monitoring and evaluation work you are doing? And again, what are the challenges with this data and the platforms, and what could be useful for you, both for you and for the people on the field? What could be useful in terms of improving the family planning policy life cycle in your country?
Okay, yeah. So in terms of monitoring and evaluation, so well, the challenges, I think it's actually caused it's pervasive. It's actually at different level. For instance, access to quality data, it's a major challenge, and there are different reasons why this is probably a major challenge, because for instance, there are issues in terms of the number of those who are trained to be able to get data from the from the field. Those who have the requisite skills, to have data from the skills from on data collection. And of course, even if you have personnel who are skilled in this, they are also reduced in number, to be able to get the quality data from the different levels. And aside from that, access is also another problem. In terms of access, there are some areas that have terrains that are hard to reach areas, and then again, a larger population of those who are in these areas, they are even the ones that are particularly more underserved in terms of FP services. So in terms of monitoring, I think what are those solutions to issues of monitoring? One, there needs to be there's need to train more people on how to capacity building, on ensuring on data management, and ensuring quality assurance in terms of data management too. So and in doing this, we can leverage on different digital platforms. Like we know that we can actually leverage on the digital training. For instance, for those who are, we can easily just organize some form of training where people can meet virtually, and we can build their capacity on data management and data capturing. Then, in terms of supportive, we can also provide supportive supervision, real-time supportive supervision at the facility, at the field level. We can make use of leverage on tablets, mobile phones to capture data. We can actually design it also boils down to data, how we design our tools on the electronic the digital platforms to be able to mirror what exactly is at the level of the registers in the field, at the field or at the field level, for effective data capturing, because it allows for ease of data capturing and management at that level, because the quality of our data is also very crucial in taking a lot of decisions. That's the only way we know how what are the needs at the level of the facility across the country. So we can leverage on that, use of tablets, use of mobile devices to be able to take appropriate data. And I believe healthcare workers and data healthcare workers who are into data collection at the facility level, at the field level, should appropriately be trained to be able to leverage on this. And the different, of course, on different mobile platforms, we also have the different applications that can easily come up with dashboards that at the level of the facility can also help at the field level. As they are inputting their data, they also have a real-time feedback on the quality of what they are also inputting, allows them to be able to take decisions immediately at that level. And of course, it optimizes the quality of whatever comes from that level. And whatever device you're also using, we in trying to come up with policies to address monitoring and regulation at that level, we should ensure that they are also user friendly, because when they are not user friendly, sustainability might be a challenge. Acceptability might be a challenge at that level. So these are some of the things that we need to continue to look at. And so the areas we also need to focus on is training on how best to utilize the newer platforms in capturing data and using data for decision making. And of course, we also know that now before now, a lot of facilities depend on the use of paper registers at the facility level, which can be cumbersome, and also transmission of data is always quite delayed, and then there might also be loss of data at any point in time. But now there's also now leverage on electronic medical records system at the facility level, which allows for ease of transmission of data from that level. And you also can easily come up with dashboards on which decisions can also be taken at the different levels, and it allows for ease of discussion amongst stakeholders to have a real-time access to the different data platforms, to know exactly where the gaps are timely in FP service delivery, and be able to come up with the right policies and the right solutions to addressing these identifiable gaps at the level of the different levels. Thank you.
Great, that's great. Just one quick question: what kind of information do the dashboards usually have? And then another question I have is, you mentioned some of the data is collected on paper, but is also the data collected on like tablets or phones or something like that? And how's the process for that?
Okay, so what I meant is, for instance, in terms of service delivery at the facility level, for instance, so for each client that accesses care, there are clear documentation in the registers of the number of, for instance, new family planning acceptors, the type of methods, the biodata, everything about all the necessary information about any new client that comes to the facility. So there are always use of papers, use of registers, and then the at the facility level, they document all this in their registers, in their paper registers, and their those are their source documents. But then, introduction of electronic medical records makes everything to actually be very easy. And even at different levels, everyone will be able to have a real-time access, to whatever data that is needed for decision making across board. And of course, the dashboard speaks to what the indicators are, the indicators that you are also trying to monitor, because at the different levels you are looking at, for instance, you are looking at, acceptability, and the end outcome, actually, you're looking at how best to reduce unmet need for family planning, and how best can you also do that. At the facility level, the number of people, the more, you have a number of people who are now coming as new acceptors of different FP methods. So on the dashboard, you can easily see the trend following different community sensitization, different advocacy within the community, for instance, and you realize that because of this advocacy, because of this community sensitization efforts at that level, there has been resultant increase in the number of new family planning acceptors, and you'll be able to also access that on the dashboard. So those are some of the